Good evening, and welcome to Niceville News and Beyond. Tonight we're going to discuss a decision by the Niceville City Council this week concerning a decades-old public health practice that's recently been determined to be a health concern: water fluoridation. Since 1945, fluoride has been added to public water supplies in the U.S. to combat tooth decay. Today, roughly 3/4 of Americans receive fluoridated water. While this has contributed to reduced cavities, the conversation is shifting to potential risks, especially regarding neurological development. Some cities have made the decision to end the practice of adding fluoride to their community water supplies. A recent review by the National Toxicology Program, NTP, concluded with moderate confidence that higher levels of fluoride exposure are associated with lower IQ in children. This finding is based largely on studies conducted in countries outside of the U.S., where some individuals were exposed to more than 1.5 milligrams per liter of fluoride in drinking water. A meta-analysis of 74 studies reinforced these findings, showing a statistically significant association between higher fluoride exposure and lower IQ scores in children. The analysis indicated that for every 1 milligrams per liter increase in urinary fluoride, there is a decrease of 1.63 IQ points in children. It's important to note that the NTP review examined total fluoride exposure from all sources, and that there was not enough data to determine if the current recommended U.S. level of 0.7 milligrams per liter in drinking water has a negative impact on children's IQ. The Environmental Protection Agency's EPA current limits for fluoride in drinking water are based on impacts to teeth and bones, not neurological effects. The EPA sets the maximum allowable level at 4 milligrams per meter to protect children from dental fluorosis. Dental fluorosis, which can cause tooth discoloration, is a risk of overexposure. Now, for the good news. This week, the Niceville City Council voted unanimously to, as soon as is possible, cease the practice of adding additional fluoride to the city's water supply. When asked to clarify as soon as possible, the mayor informed the citizenry, "Tomorrow is when this will happen." One must wonder what else is going on, which is harming us without our knowing or made aware of any of the risks known only by the peddlers and those benefiting from the criminal unions. Like and subscribe. Please stay tuned for more from your local news source, NNAB.